Hello, I'm Stacy Okander, the Dean of Health and Public Services at Metropolitan Community College. We often hear that the world is an uncertain place. It's even more uncertain now with all the news about the Ebola virus and infectious diseases. Today with me in the nursing lab at the South Omaha campus are Peggy Dean, the Program Director for Emergency Medical Services, and Nancy Paris, the Director of Nursing Programs at MCC. Metropolitan Community College has always responded with curriculum that prepares students for an ever-changing workforce. Whether it's the latest in automotive technology or new discoveries in horticulture science, MCC quickly develops learning so our students can succeed. Infectious diseases in all of its forms require us to develop health curriculum quickly, ensuring that it includes breakthroughs and new techniques. Peggy, Nancy, and I are here today to discuss MCC's curriculum, and how we're responding to infectious diseases. With all the news about the Ebola virus and infectious disease, we know it's important to provide accurate information to the public. And to let you know that MCC is developing training specifically for students who will enter the workforce as first responders or in hospitals. Peggy, can you share with us what MCC is doing to prepare first responders?
We have two jobs in our EMS program, and that's to prepare our students to ride along in the field on the medic units as a student and how to respond, and then also prepare them for when they are out in the workforce and how to establish their own response according to their medical direction and guidelines. As a student, we follow the local guidelines of the fire department, such as the Omaha Fire Department, the Fremont Fire Department, where our students ride along. In this particular instance, since the Ebola virus has been recognized, the lead medic on the squad, if they respond to flu-like symptoms, will go into the house alone, fully garbed in infectious disease materials, so they'll be donning the infectious disease gear. They will go in and initiate the initial questions of someone that has flu-like symptoms. So what are your symptoms? Do you have a temperature? And then follow that up with, have you been out of the country recently? Or has anybody visited you that has been out of the country recently? So following the questions, the lead medic will then make a determination if he goes back out and brings in the rest of his staff that it's safe to come in, or they will make a decision on whether just he will monitor the patient until a designated squad that is designated to transport patients with flu-like symptoms that fall in the criteria of a possible Ebola virus scare. We also prepare them for when they're out functioning on their own and teaching them how to don and doff the proper equipment, how to respond to patients with infectious diseases. We always teach about infectious diseases, but as you said, the Ebola virus is something new right now, so we are focusing on that at the moment, but we always teach infectious diseases. This has just brought about the importance of adding infectious disease equipment. So we kind of have two jobs, and that's what we focus on, and it's just what we do in everyday class. We just emphasize more since the virus has come around.
You know, as I mentioned in the beginning of our conversation, we're in the nursing lab at the South Omaha campus. We have state-of-the-art facilities in which we provide this up-to-date curriculum for our students. So really what you're saying is we're not doing anything different than we've always been doing. We just have a renewed awareness, or a stronger awareness of the protection that we need to take and the things that we need to do, just like we would have with H1N1 or anything else in terms of communicable or infectious diseases.
Absolutely right. We're just reviewing the procedures.
Great. Thank you, Peggy. Nancy, can you tell us how nursing is responding to these issues?
Yes, certainly. I would tag on to what Peggy has to say about the renewed emphasis on the standard precautions that we teach from the very beginning of our nursing programs. Because there's something new out there, there are specific questions that need to be asked. By the time our students get a patient that may be questionable or probable, that has really probably already been determined. We're in acute care settings. Unless they're working in a community health environment, which doesn't happen frequently, we do have some students that do go to the emergency room at various facilities. as part of their observational experiences. And again, they are involved with other healthcare personnel who have been specifically trained. So it's not that we are changing what we're teaching them. We have standard precautions. There are specific protocols and procedures that every facility has regarding infectious process, whether it's contact precautions or droplet precautions. Those are still enforced, and those are facility specific as well as infectious disease and CDC guideline specific. Those are all things that we have always taught within our nursing program. But again, a renewed emphasis to just kind of remind everyone there's something new out there. It's a little bit different, and specifically coming from outside of the United States. The students are keen on understanding what their standard precautions are and what their role as a student as well as a future healthcare provider is.
And I would imagine if I were having this conversation with the program directors of medical assisting or respiratory therapy, these would be the same responses that we'd get. As we've been doing this forever, there's just a renewed awareness of what we need to do because of the scare or the unease with the Ebola virus.
Mm-hmm. That's correct.
Absolutely.
And we know that we're providing education because we have students who are working in some of these units or on some of these units, or are in the squad or whatever that's responding to some of these infectious disease situations.
Mm-hmm. Right, right.
Great. Well, thank you both. It's important to know the facts and the myths about infectious disease. We are fortunate enough that we have experts in our community, experts who are the gold standard of care and medicine. Nebraska Medicine and their biocontainment unit are the leading edge of research, science, and treatment. They make available to the public several pieces of information that are free that keeps us up to date with knowledge on how to protect ourselves and our loved ones. They have a wealth of information where you can learn about the facts and the myths. Nebraska Medicine is the gold standard for treatment and care of Ebola and infectious disease. We would like to share with you a little bit about Nebraska Medicine's biocontainment unit now.
Ebola, a viral infection that students read about in textbooks, barely a paragraph, rarely a manuscript, no national meetings, just a word that has struck the lives and the focus and the anxiety across the United States and around the world. Originally starting in West Africa, in small rural communities, spreading to urban centers, infecting thousands, killing thousands, and projecting to take the lives of nearly 1 million people before this epidemic is over, crossing the oceans, spanning all of the continents, and bringing the state of Nebraska, the city of Omaha, and the University of Nebraska Medical Center and Nebraska Medicine to the top headlines, not only here, not only in the United States, but around the world. In 2005, we cut the ribbon on the biocontainment unit here at the University of Nebraska Medical Center. Many thought it would never be used, that it was the rare infection or the isolation of a traveler or somebody coming in from other parts of the country. But now we know that reality has occurred and that we've not only cared for one, but two, and possibly many others as time evolves. We now know that these are not only patients that are tragically infected halfway around the world, but are infected here in our own cities and in our own communities, whose children attend our schools and whose parents attend our churches. Join me as we take a video trip through the history of our biocontainment unit.
Now, the latest on the Ebola outbreak in West Africa, which is moving faster than efforts to contain it.
As you know, it has affected several countries now, and this is of concern.
The biocontainment unit at the Nebraska Medical Center is one of 4 in the United States.
The idea was that we could give this person first-class care in an environment that provides for optimal safety.
We were contacted by the United States Department of Health and asked if we would participate in the care of an American physician who was diagnosed with Ebola.
His flight landed minutes ago. 51-year-old Rick Seka will be treated in an isolation unit at the Nebraska Medical Center in Omaha.
This is completely consistent with the mission of the Nebraska Medical Center.
Some police escort as Dr. Saker is making his way from Offutt Air Force Base right now to the Nebraska Medical Center.
The third American aid worker to be infected with Ebola is sick but stable.
We were scared. We were scared.
The tough nature of this disease is just the fact that there isn't any notable therapy.
So we're learning not just by watching him and treating him, but also by his descriptions.
We've been cared for on every level by the physicians, the nurses, the administrators, everyone at this great institution. Nebraska really should be proud.
Nebraska 1, Ebola 0.
Hugs and smiles today at the Nebraska Medical Center. For the first time, an Ebola patient walks out of the biocontainment center with a clean bill of health.
The CDC has declared me safe and free of virus. Thank God, I love you all.
I just wanted to tip my hat in particular to our team, nurses, RTs, and techs. You were boots on the ground 24 hours a day. You acted with courage and compassion, and I'm very proud of every one of you. Thank you.
I am so grateful. Thank you so much. And you know, you all have made me feel so welcome here that I am now an official lifetime Huskers fan. Go Big Red!
Good evening, I'm Brandy Peterson. By this time tomorrow, Omaha doctors will be treating their second patient with the Ebola virus.
An American stricken with Ebola is in the air traveling to the United States for treatment. Ashoko Mukpo arrives Monday at Nebraska Medical Center in Omaha.
Let's start on a Monday morning with our top story, concerns over Ebola in America. A plane carrying Ashoko Mukpo, the photojournalist who was working for NBC News in Liberia, he'll be treated for Ebola at a hospital in Nebraska. NBC national correspondent Kate Snow is in Omaha with the latest on this. Kate, good morning to you.
Good morning to you, Matt.
I can inform you now that we are presently treating the second patient infected with Ebola virus here at the University of Nebraska Medical Center.
He's enormously relieved to be here. Of course, it's still quite frightening, but he's hanging in and he sounds very strong.
Hospital officials say 33-year-old Ashoko Mukpo has shown a modest improvement since arriving at the Nebraska Medical Center with the Ebola virus on October 6th.
He is seriously ill, but he's stable, he is conscious, he is awake, he is conversing.
The Omaha patient is doing better. And we heard today from that patient. Ashoko Mukpo is on Twitter this afternoon, first saying, "Feeling like I'm on the road to good health." We'll be posting some thoughts this week. Endless gratitude and good vibes.
So what we want and need is similar to what you find at Emory in Nebraska. Nebraska has sort of become the gold standard for us. So that particular type of equipment, hazmat suit, respirator masks, and then the buddy system where we can watch each other don and doff, each one make sure the other's seams are taped, that kind of thing.
It's very crucial that there's transparency. We learn not only what went wrong, but as we're learning from Emory and from Nebraska, what went right, because they're now spreading out, they're distributing protocols. I saw them this morning about exactly how to do the PPE, for example.
The second man brought to Omaha for treatment of the Ebola virus is ready to go home.
The news just in from the Nebraska Medical Center. A new blood test confirms Ashoko Mukpo no longer has Ebola.
I am proud to tell you that as of 30 minutes ago, it is University of Nebraska 2, Ebola 0.
This really is big news, considering that only 15 days ago we all watched as Providence native Ashoko Mukpo arrived at the Nebraska medical facility after testing positive for Ebola, and now health officials say he's free of the disease. Mukpo is now the second Ebola patient treated at that facility in Nebraska.
When the day came several months ago in early September to have to stand up and take the responsibility to deal with American citizens who were stricken during missionary care halfway around the world, I'm proud to tell you that our community, our physicians, our nurses, our therapists, pharmacists, our occupational therapy people, etc., have risen to the occasion and done an absolutely remarkable job.
When I first came in, Dr. Smith, I looked up at him and I said, "Am I going to make it?" And he goes, "We don't know a whole lot about this." And I was like, that's not the answer that I want. But at the same time, I know this guy isn't going to give me just a line that's not true. And, unwavering professionalism the whole time, pure honesty, just knew what he was doing. This guy is amazing. And yeah, thanks a lot, Doc.
It's vital to know that information is changing every day, even hour by hour. Nebraska Medicine has a wealth of information where you can learn about the facts and also know the myths. Here are a few pieces of that information.
Greetings from Nebraska, and thank you for joining us for a short talk that will help you know more about the Ebola virus. These are the points that we will cover in this talk. We are going to explain the virus. We're going to make clear some of the words that you may hear in the news, and also talk about how Ebola spreads. We're also going to talk about what to do if you think you may have Ebola, and then what you can do to protect yourself and your family. Ebola is a virus that causes an infection. Right now there are many cases in West Africa, and there have been a few cases in the United States. A virus is not like a bacteria. Antibiotics do not work on viruses. We treat the symptoms that the infection causes. Viruses need living cells to stay alive. If we can stop the virus from getting from one person to another, we can stop the spread of the virus. The signs and symptoms of Ebola start with a fever, muscle pain, and headache. These are common for many infections. Then people may feel nausea, vomiting, and diarrhea. Later on, there can be a rash and some bruising and bleeding. And yes, people do die from Ebola. People who are exposed have had direct contact with someone who has Ebola. People who are infected get sick from that contact. Remember, just because you are exposed does not mean you will get sick with Ebola. If you think you have been exposed to someone who is sick with Ebola, you want to call your local public health department. They are trained to ask you the right questions to decide if you are at risk of getting sick. Keep in mind, if you are exposed, you will not get sick right away. It may take up to 21 days to get sick. That is what we call an incubation period. You cannot spread the virus until you have symptoms, and after 21 days, you can believe you are not going to get sick. If your local health department decides that you were exposed to someone with Ebola and you do get sick, you will have to get medical care right away. Remember that you will want to call ahead to the hospital and say that you are coming in with symptoms of Ebola. To protect others, you will be kept in a separate room in the hospital for your care. Your care providers will wear protective equipment when they come into the room to care for you. Some hospitals have special biocontainment units with extra built-in measures to protect everyone. The Ebola virus is spread by direct contact. This means it can be spread if the person who is sick with the virus has blood or body fluids that touch broken skin or body openings of another person. Body fluids are urine, feces, saliva, vomit, breast milk, and semen. Body openings are mouth, nose, eyes, or by sexual contact. Ebola can also be spread if contaminated objects like used needles or cloth, sheets or towels, touch broken skin or body openings such as the mouth, nose, eyes, or by sexual contact. Ebola cannot be spread in the air. People can only spread Ebola if they are sick with the virus themselves. The only animals that are known to spread Ebola are infected bats and monkeys, and this has only been observed in Africa. There are no known insects that spread Ebola, and it has not been spread in food or water. We are still learning about who gets sick. These people may be family members and other people in close contact with infected people. They may be healthcare workers who are not protected enough, and they may be people who have direct contact with an infected dead body. We often get asked, what does quarantine and isolation mean? Quarantine is when you keep someone who is exposed to the virus but not sick away from others. And isolation is when you keep someone who is sick away from others, usually in a hospital. At this time, Ebola is mostly treated with fluids and medicines. Patients have to be very closely monitored. There is a lot of research right now to discover new medicines and vaccines for Ebola. If you return from a place where you were exposed to Ebola patients, you should contact your doctor for advice. He or she will talk to your local public health department. Before you travel to high-risk areas, you should check to see if there are travel rules. The Centers for Disease Control and Prevention has a web page with recommendations for travel to countries where there are Ebola outbreaks. The best way to protect yourself and your family from Ebola is to be informed. Get your facts from the experts and be sure to share those facts with your friends and family so they will understand how Ebola is spread. Be sure to tell your doctor or your local health department if you think you've been exposed to Ebola. And always remember that getting a flu shot every year will keep you healthy and protect you from the flu, even though it won't protect you from Ebola. There are 3 things you must remember to not touch to protect yourself from Ebola. Don't touch someone who has Ebola. Don't touch objects that have touched the body fluids of someone who has Ebola. And finally, don't touch the body of someone who has died from Ebola. This presentation was developed from a variety of resources, including but not limited to the Centers for Disease Control and Prevention, the World Health Organization, and the Nebraska Biocontainment Unit. Thank you for joining us for this talk. We hope you have learned a lot and that you will share these facts.
Visit Nebraska Medicine's website often to stay current, or visit your family physician with questions or concerns that you may have about a possible exposure to Ebola or infectious diseases. An informed, knowledgeable public is a safe public. And know that Metropolitan Community College always responds with learning that prepares students for today's challenges.